As a fourth-generation entrepreneur and business owner, I know the grit and grind that it takes to run a business. With ChingonSA, we're capturing stories from other local business owners and community leaders to highlight them for you, our querido community of San Anto. From the culture, for the culture. What's up, everybody? Welcome back to another episode of ChingonSA. I'm Luis. I'm the host of the show, and I am super excited to continue this series in the month of March of celebrating women, entrepreneurs, business owners. And I'm excited to welcome our next guest, Maggie. Thanks so much for coming on the show. Margaret Bean, or Maggie as known to many, is a licensed marriage and family therapist serving clients across Texas, Colorado, Montana, and a state-approved LMFT. Man, I'm dyslexic. I'm glad I got that right.
All in the first go.
That's right. Supervisor in Texas and Montana. She works with individuals, couples, and families navigating anxiety, trauma, grief, identity, and complex relationship dynamics, including both traditional and non-traditional partnerships. Maggie is deeply committed to creating a safe, affirming, and judgment-free space, especially for queer, trans, immigrant, and other often underserved communities. Her style is collaborative, grounded, and refreshingly human, blending evidence-based therapy with humor, compassion, and what she calls a co-opt quest. I'm interested to learn more about that. To help people rewrite old narratives and build stronger emotional resilience. Beyond her work with clients, she's also a mentor and supervises the next generation of therapists the next generation of therapists, helping them grow into confident, ethical clinicians. At her core, Maggie's mission is simple, yet powerful, helping people live more authentic, aligned, and empowered lives. I love that.
Thank you.
Yeah, that was a great bio. Yeah, it was a great bio. Thanks for coming on the show. I appreciate it.
Thank you so much for having me.
Yeah, of course. So we met because I posted in a women's business owner group that I was looking for. I was wanting to highlight women entrepreneurs and business owners, and man, I was so shocked at the amount of responses that I got.
Yeah.
And I wish I could have everybody on, but obviously time won't allow that. But yeah, I'm so glad we came across each other. We connected on social media, and you agreed to come on the show.
Yeah. Thank you for moving things around. I know that last time I had to say, hey, I have a client.
Yeah. We were going to record earlier.
Yeah.
And then we had to move some things around for you, but that's okay. It all worked out. I'm glad you're here. So are you originally from San Antonio?
No, actually, I'm from Laredo,
Okay.
Texas. Mm-hmm.
What brought you to San Antonio?
School. I ended up going to Our Lady of the Lake for my master's program.
Okay.
Yep.
Yeah. How long have you been here now?
Oh, that's a good 10 years.
Okay.
Yeah.
All right. So
I'm
you're
pretty much
yeah.
San Antonio adjacent.
San Antonio home.
Yeah.
Well, good. You got here as fast as you could.
Yes.
That's what counts.
Yeah.
Yeah. Well, good. Glad to have you. So you started your journey in counseling at the Rape Crisis Center.
Yeah.
As an intern.
Mm-hmm.
You saw some gaps in access to mental health care.
Mm-hmm.
I want to take you back to that moment when you started to kind of realize, hey, this is something that I'm seeing a need for.
Yeah.
And you wanted to have an impact on that. What was it that you saw in the community that made you think we need to build something better for ourselves?
So the Rape Crisis Center is an amazing resource, right? It's free for everybody that goes there. But I've always had this passion for like the marginalized communities, the ones that aren't always understood. So like the kink community, the ethically non-monogamous community, or consenting non-monogamy. And I ended up having clients as an intern, right? Because I did go back and work there after I graduated.
Okay.
As an intern, I had clients that were in the kink community, and I realized that they were being judged a little bit.
A little bit.
Just a smidge. But I had someone who was a fully licensed clinician be like, oh, well, are you sure that that's not just a form of self-harm? And I was like, no, it's not. And I instantly started thinking this is a community that just doesn't have enough representation and enough people who understand them.
Yeah.
And so Kelly, my co-owner, and I actually met at the Rape Crisis Center. And so she and I started talking about it because she was also seeing teenagers that were there. And she was like, yeah, my trans clients, it was still, way back when it was still even more scary than now to come out about that. She was like, yeah, they're like, don't have enough resources outside of RCC to be able to be seen. And that's just kind of how our brainchild began. Like, we started realizing that these communities just didn't have enough resources.
So is it fair to say the Rape Crisis Center is like basically like a triage, right? Just to kind of get you to a place where you might, or someone, going there needs immediate help.
Yeah.
Right. But it's not really set up for long-term assistance, or is it?
It is. So it is and it isn't, right? Okay. I know that since I've been there, it's changed a little bit. Because of current politics, they've lost a lot of funding.
Sure.
Back when I was there, they had, teams of people, advocates. They had outreach programs that would go to schools and educate, to other businesses and educate. They provided CEUs. They did groups. They had therapists. They even had a human trafficking division. And so it was set up so that at every point, anybody who was a survivor of assault could gain access. Going to the hospital to get a kit done, leaving a situation. They had advocates to help them find community resources, and then amazing teams of therapists to be able to help process all of that. It's just that when they're there, they have to be working on that trauma. They have to be focused on the trauma because that's what the RCC is for, right? And so whenever it comes to long-term, like depression or anxiety, bipolar disorder, anything of that nature, we would have to refer out. And so that's why we were like, no, we need to be an outside source where it can be long-term. Yeah,
that's interesting. And I mean, you bring up a good point, right? I think the funding, the choices of funding that are being directed by the government obviously don't kind of align with the RCC, which is what's causing the shortage. So like, I guess how long have you been in practice?
So I've been in the mental health field since 2015, so 11 years.
Nice.
And then I worked for agencies for a long time. And then in 2022, I joined a private practice. And then in 2023, we started our own.
Nice.
Yeah.
And it's you and another partner.
So Kelly Clark.
Kelly, yeah. Mm-hmm. Not Kelly Clarkson, not to be confused with Kelly Clarkson.
Not Kelly Clarkson. I wish. That'd be really cool, but
no kidding. I had a huge crush on her when she in her American Idol day.
Gorgeous.
Anyway, but Kelly, going back, so you guys met while you were interns at the Rape Crisis Center.
Yeah.
And you guys were had a kinship basically over the fact that you had a passion for wanting to serve these folks. When did you make the decision like, I want to do this on my own?
So this is where it gets kind of funny.
Okay.
So Kelly actually went to OLU, but she was a year older than me.
Oh, gotcha.
Or not a year older. She's actually younger than me. She's a year ahead of me.
Okay.
And so we met at the RCC. I ended up graduating and I got a job at BCFS. Right?
Okay. Yeah.
She ended up finishing her hours and she went to a private practice.
Okay.
And so we stayed friends and we kept in constant communication with each other. And then ironically, 2 years later, we ended up working at the same private practice.
Oh, wow.
And it just so happened that way.
Yeah.
A friend of mine had said, hey, they're looking. I wanted to get out of agency work. So I jumped in. I worked there and I was just like, hey, Kelly, you should think about applying here. This would be great.
Yeah.
And so she joined. And then we just kind of started talking about it. We started to kind of see behind the scenes because it was a very small private practice. But we realized that there were certain things that we would do differently.
Yeah.
And so we just kind of started talking about it in realistic terms. And of course, that's scary.
Yeah.
In the mental health field, it's scary. Because it's a saturated market. And so we had to define, okay, how are we going to be different? How are we going to be that safe space? How are we going to be, what do we want to be known for?
Yeah.
And so we started kind of coming up with ideas, and we were like, what are we going to name this thing? Because that's also hard.
Yeah.
And her mom screamed up the stairs at her, it needs to be ABC. And so because I'm Bean, she's Clark. And then we had someone who was working with us. Her last name was Arriaga.
Okay.
So ABC.
Oh, okay.
And so we were like, we can do it. And so, I mean, we had a serious conversation in April. In May, we were signing paperwork
Oh, wow.
with my accountant to be able to set up our corporation. Yeah. And then in August, we started virtually. And September, we got the keys to our office.
Your new space.
Yeah.
Where are you guys located?
On the corner of Worsbach and I-10 in the Colonnade building.
Okay.
Yeah.
Nice. And we were talking before the show, you guys are looking at a bigger space in the same building because you're growing.
Yeah.
Yeah, that's great.
We're very excited. We are now a learning practice, so we have interns.
Okay.
And so we want to make sure we have enough space for our interns to be able to do their sessions and hold groups and things like that.
Okay. Yeah. What is that like? What is that you're getting to that point now, you're talking about growing and bringing on new people. Yeah. How many folks are with the practice currently?
The last time I counted, there was 11 of us.
Wow.
Our administrative director, our clinical director, and then therapists underneath us.
Wow.
Yeah.
Good for you guys.
Yeah.
That's awesome. And so you're looking to grow even more, looking to be able to serve more people.
Yeah.
When you think about that from the business perspective, right? Like, what is that like for you? What kind of feelings do you go through?
It's nerve-wracking, definitely. Because these are mouths we have to feed, right? Yeah. We have to be able to market appropriately. We have to get our name out there, network, and make sure that we're getting enough referrals for our clinicians to get paid.
Sure.
Private practice is different than agency work. Agency, they'll throw you people. You're going to be on a salary or hourly pay. That's great, and some people thrive in that. But they burn out their clinicians rather quickly if that's not an environment that you absolutely love. I have a supervisee, loves it. Couldn't be happier.
Nice.
But then I have others like myself that are like, that's not for me. That's too fast paced. And private practice, as a business owner, I'm like, okay, we're hiring new people. We need to make sure that we're pushing their name out there. We're sending them invitations to go network and be able to meet other people in the community. We got really lucky that I met with Amanda from the Clarity Child Guidance Center.
Oh, yeah.
Yeah. And so we get referrals from them, which is really nice. We love helping our kiddos. We start at the age of 3.
Oh, wow.
Yeah. We start real young.
Yeah.
And we go all the way up. So it's nerve-wracking, but exciting.
Do you have therapists that like focus in different areas? So like you're talking about, child therapy. So do they also do like play therapy and all that kind of stuff? And
play therapy, Santre. We have a clinician who does EMDR. Myself and Kelly were CPT certified, which is cognitive processing therapy. It's cognitive behavioral, but on steroids for trauma.
Oh, wow.
And so we have a lot. Kelly is getting certified in being able to do autism and ADHD diagnosis. And so we cast a very broad umbrella.
Yeah.
Yeah.
Good for you guys. Is there something that you personally prefer to work in, like the space that you prefer to like kind of stay in?
I love my couples.
Yeah.
I love seeing my couples, especially my queer trans immigrant couples. They're not everybody. Let me rewind for a second. There are a lot of people who will focus in on like heterosexual couples.
Sure.
Right? A lot of people specialize in that area. I went into extra trainings to be able to provide for the others that don't have that representation.
What does that look like? I guess the better question is like, when you say you went into extra training, like how does that happen? Like where do you find these trainings?
I look online. I also took some trainings through the Sexology Institute when they were doing a bunch of workshops.
Okay.
Love Shack Boutique also does a lot of workshops, which is great. Amy's amazing. Her whole team is. And I just wanted to learn as much as I could about the consenting non-monogamy. So like I see polycules.
What are polycules?
So polycules.
Educate me, please.
So when people are in polyamory, there are things called polycules, which means it's not just 2 people and that's it, right? There's I won't get into it. There's so many different variations
Okay.
of molecules.
Okay.
But I see them as a system. So I have seen a hinge couple, right? So one person who has two partners.
Oh, okay.
And
one person has two partners.
yeah,
Okay.
so it's like the two partners don't date, they don't interact, they're cordial, right? They know each other, but they're only with that one person.
So that's not a throuple.
It's not a throuple.
That's different than
That's
a throuple.
different, yeah.
Okay.
Because a throuple means that they're all kind of dating each other.
Oh, gotcha.
Yeah.
Okay.
Mm-hmm. And
Man,
so
this is complicated stuff.
Yeah.
I have enough trouble managing one relationship. I can't imagine.
It's the same. It's really the same as a heterosexual, like, normal couple.
Yeah.
It's just, you have multiple partners, and it's someone who has to be dedicated to having time for each one and fostering healthy relationships and communication with everybody.
Yeah.
I've seen a polycule as big as 5.
Oh, wow. So they can be more than 3 in, well, and is that hinge that you're describing, is that so when there's 5, it's one person dating 4 people?
There can be that. It's not always like that. Mine, the one that I saw where it was 5, it was a throuple but 5. So they were all living in one household.
Oh, gotcha.
And they were all kind of dating each other.
Okay.
And it was just this big little village that they had together.
Okay.
Yeah.
Yeah. Interesting. All right. Cool. So you, going back to the original question that I completely
we swirled. It's okay.
Yeah. So your focus, you prefer in terms of your practice, you prefer couples basically, and traditional and non-traditional couples,
and individuals also. Okay. I work with sex workers.
Okay.
I'm a non-judgmental space for sex work because it is real work. It takes a lot out of a human to be able to do that.
Yeah.
I also work heavily with the kink community, the trans and the queer community. Right now it's a scary time, and so I am very loud and proud about being a safe space for them.
Yeah.
And that I document appropriately to make sure that they're safe.
You mentioned earlier, and I think in your bio I read that you also do a lot of work with immigrants.
Yeah.
Let's talk about that. What type of work are you doing with immigrants currently?
So we just got trained by Dr. Bernadette Solorzano, who's an amazing therapist. We got trained to do immigration assessments.
Okay.
To be able to help with visas, and doing biopsychosocials to be able to help provide back to the community so that they can go through the legal process.
Okay.
And be able to have documentation to show as to the reason why they should be granted their visa. Yeah.
Interesting.
Yeah.
I bet you guys are pretty busy with that right now, right?
A little bit. It's definitely picking up. We also get lucky that we have bilingual therapists.
Oh, good.
Yeah. So we also provide therapy bilingually.
I heard something recently from a influencer I follow on, a Latino influencer I follow on social media, and he was saying something that he said earlier struck me. He was talking about how millennials are the first generation, Latino millennials are the first generation where we've almost had to sort of parent both generations, their own children as well as their parents.
Yeah.
Because their parents, the parents of millennials, need to understand that it's okay to talk about your feelings.
Yeah.
Right. And also not repeat those same teachings that you learn from your parent with your own kids.
Yep.
Is that fair to say?
Yes. Yeah. One of the areas that a lot of us specialize in is intergenerational trauma. And that has to do with passing down those lessons, those hard learned lessons. And we get a lot of families that it's parents, even with their adult children, that are having to come for family sessions because, the world's changed. Views have changed. Myself, an example for me is I have older parents. I was born when my mom was almost 40.
Oh, wow.
And so I have a very separate generation that I'm attached to versus my little ones.
Yeah.
And so as a human and as a therapist, I work from that point of view where it's like, okay, well, there are lessons that they taught you that they were taught by their parents that no longer apply now.
Sure.
And so it's like you're having to learn to be a parent while being a parent to two different kind of little sections
Yeah.
of your life.
Yeah.
Yeah. And so it's definitely a challenge for a lot of people.
Yeah. I've been in therapy for 14 years now.
Yeah.
Uh, my mom watches the show, so she's not going to appreciate that I'm bringing this up, but it's funny. Every time I bring up my counseling sessions, my mom goes, "What? Let me guess. She told you it was my fault, right?"
My mom did the same thing when I was going to therapy.
And it's that's not what it's about. It's not about placing blame. It's about like figuring out, how I was impacted by that, how that affected my life, and how to navigate that, right? And it's not about
whose fault it is.
No, but anyway, and I don't blame her. I blame my father, but that's a different story. that's an entirely different episode.
For responsibility, where responsibility is due.
Exactly. So you're not just a therapist; you're a co-owner of a locally operated practice here in San Antonio. How was building the mental health business in the city shaped your approach to leadership, culture, and the way you serve people?
It's definitely shaped. So San Antonio is very unique, right? I come from Laredo, where there's such a massive lack of therapists, so massive. And so when I came up here and I saw how saturated the market was, I was like, oh man, okay, we need to think outside the box. And so it was learning the area, one, that we wanted to be in. The reason why we chose our location is because there's a Via bus stop right in front. There's like a big one. Yeah. And we wanted to be accessible because we take Medicare and Medicaid. And there's a lot of people who don't have forms of transportation other than the bus. We wanted to make sure that we were centralized close to medical center because some of us treat medical trauma. And we also see veterans, and the VA is right there. And so when we were shaping kind of our mission, we were having to take into consideration all the different parts of what San Antonio is. Yeah. We also got really excited because we were thinking about it and we were like, okay, well, Hispanics are not the only ones that are here in San Antonio, right? We have Asian and Middle Eastern. And so when we were looking at our interns, we love getting people who are bilingual in other things than Spanish. And so for a semester, we actually had someone who spoke Turkish. Oh, wow. And so we really tried to create a space that really spoke to what San Antonio is, which is like this big old melting pot of populations. Yeah.
That's awesome. I love that. Man, I it's so cool that you guys really were intentional and put that amount of thought into even your location.
Yeah.
That shows that you really are passionate about who you're serving, what you're doing, and how you're doing it.
Yeah.
So good for you guys.
Thank you.
Yeah. So, whoa, my notes kind of flickered there for a second. So you've worked with trauma survivors. You've worked with foster care population. We talked about underserved communities throughout your career. How do you feel like some of those experiences influence your decision to go from a clinician to an entrepreneur instead of staying in a traditional agency setting?
Honestly, it's because I always knew growing up that I wanted to do something that was very person-centered. Yeah. Right. And so I love seeing my, I'll go on a tangent for 2 seconds. So I love seeing my college students who were like, I don't know what I want to do with my life. I can't keep switching. And I'm like, dude, I switched from being, I always joke when I was in elementary, I used to say, I'm going to be a nun. Okay. That obviously didn't happen. But then I was like, I want to be a vet. And then I was like, no, I don't want to see animals dying. Then I was like, I'm going to start college for a teacher. I started started doing my schooling for being a teacher. And I was like, no, this isn't what I want to do. I don't want to work for this kind of thing. Then I switched to criminal justice, and it just so happened that for my criminal justice degree, I had to take a psychology class, and I took psychology and I fell in love with it. It hits close to home because I do have a family member that has a lot of mental health issues, and I grew up watching kind of what this did to his life. And I always knew I wanted to do something to help. And so I was like, this is it. And so when I was in the agency, I was like, okay, well, I still want to teach. So I want to become a supervisor. And so becoming an entrepreneur and being able to start my own business, in ushering in new therapists, the new generation of therapists that come to me, I also want to be that helpful stepping stone of, okay, well, you're starting your own private practice. Let's talk about marketing. Let's talk about getting out and networking.
Nice.
Let's talk about partnerships.
Yeah.
Because my supervisor didn't have that experience. And so when Kelly and I started, we were just we were learning on the go.
Yeah. As most
do.
Yeah.
And so I want to be that safe space so that they can ask me questions. I wanted to become an entrepreneur, so I had lived experience to be able to pass it on to my supervisees.
Nice.
Because I don't want them, I'm not the type that's like, well, I paid my dues and I struggled, so you have to struggle. Yeah. Absolutely not. Yeah, if I can spare you that, I will spare you that.
Absolutely. And I run into business owners like that all the time. I wish there were more like what you're describing. The true leaders, I think, are about building people up and not do what I say, just because I have this experience, right? Yeah. So that's awesome that you guys are doing that. How many supervisees, I guess, do you guys typically have in a semester?
Well, so there's interns, right?
Okay.
So they're still in college. They're doing their hours to be able to even just get their degree.
Gotcha.
So we have 3 interns this semester.
Okay.
Supervisees, though, are people who are associates of ours who are trying to get their full licensure.
Gotcha.
So I currently have 4 supervisees underneath me. Kelly just got a new one, so now she's got 5.
Oh, nice.
And then Christy, who's our clinical director, who's also a supervisor, just got 2.
Oh, wow.
Yeah, so it's up to the supervisor how many they take on. Yeah. However, obviously, know your limits.
Yeah.
Right, because it does take time out, and then they're practicing under your license. So if you're not a good supervisor, you run the risk of them doing something that's unethical or not knowing what they're doing, and they're practicing under your license.
Yeah.
And so I take a lot of time to really educate my supervisees, and that's why I limit myself to about 8, especially because I'm not just a supervisor here in Texas. I can also take people in Montana.
How did that come about?
So I had a supervisee who started with me here in Texas. Well, her husband got a job opportunity in a different state.
Oh, gotcha.
And she was like, I don't want to start over new with someone else. And I said, well, let me see what it's like to get licensed over there. And so I just kind of did.
Good for you.
And so now I'm a supervisor there. So she's going to start soon at a hospital, and I'm going to be her supervisor.
Nice.
Yeah.
That's awesome. Your practice was created to meet unmet needs in communities where mental health services weren't always accessible. Mm-hmm. What's your long-term vision for ABC counseling, and how do you hope it changes the mental health landscape in San Antonio?
I hope that we are able to educate people on the difference between like an LPC and an LMFT, right? Because there are differences, right?
Tell me what those differences are.
So an LPC they're the same thing. They're therapists, right? We are supervised by the same board in Texas.
Okay.
But LMFTs it's like burned into our brain to be systemic, to think systemically. So we are specialized in the field of families and groups and relationships. Sorry.
Okay.
And so I want people to know that we're here. There's a lot less of us than LPCs for sure. But we're a growing community, and we want to be able to educate people on that.
Yeah.
I really hope that ABC becomes a stepping stone for a lot of good therapists that are going to go out there and do great work.
Yeah.
We understand that not everybody's going to stay with us forever, right?
Sure.
So we want to be able to be that private practice where it's like, hey, you want to get started, you want to learn what private practice is, and if you're going to flourish in this area, we'd love to have you. Kelly and I really want to be unlike other places that we know of.
Yeah.
That, they find out that someone's stepping out on their own and they get mad and disappointed and all these things and act impulsively.
Yeah.
Kelly and I are the type like, hey, you want to start your own private practice? Okay, that's fine. We can help you. Let us kind of walk you through it so that you don't make a mistake. Let's make sure that you're in the right spot.
Yeah.
So that you get to flourish too.
Yeah. Good for you guys. So, kind of as we wrap up here, we always like to talk about legacy, right? I love talking about legacy. If someone from San Antonio walks into your office feeling unseen, overwhelmed, or even judged, what kind of experience do you want them to walk out with? And what kind of ripple effect do you hope that your work creates in the local community or rather over the next decade?
I hope that they leave feeling safe and seen. A lot of marginalized communities are taught to be small and to be quiet. I want them to leave feeling proud and seeing what they bring to the table and that they're not small, that they matter.
Yeah.
I hope that the ripple effect is that it just kind of spreads, right? It's kind of the saying, you smile at one stranger, they smile to the next, and it just kind of keeps going. I hope that we help our clients feel safe, seen, and strong so that they can either share that with their friends, their family, their kids, right?
Sure.
That's kind of the ripple effect we're hoping for, is for people to feel safe to talk about emotions and not feel that stigma.
And I am so what's the word I'm looking for? I'm just so amazed at how most counselors seem to have it so well together. I mean, the work that you guys do sometimes can be pretty heavy, I imagine.
Oh yeah.
Right?
Yeah.
So how do you balance that with the work that you do? Like how do you balance your own wanting to take on those feelings that your folks come in with as your own?
Yeah.
How do you, and what's going on in society today, right?
Yep.
So how do you work, or what is it that keeps you motivated to continue doing this work, but also like, man, how do you not like go crazy?
It's hard because the world's on fire right now. The world that we live in right now is on fire, and I'll give an example. When I started my internship for my graduate program, I was an overachiever and was like, I can do 2 places. And
what do you mean 2 places?
So you can choose how many internship sites you have to be able to get your hours. I signed up for the STEP program with the juvenile detention and with the Rape Crisis Center.
Yeah.
And I had to have a conversation with my partner. He was not my husband back then. He was my boyfriend. And I remember telling him, I'm going to have a hard day one of these days that I come home. And I'm going to tell you, and you're just going to have to give me 10 minutes by myself to cry, scream, whatever it is that I'm going to have to do.
Yeah.
And he was like, okay. And I said, I just need you to understand that. And he goes, okay. I thought it was going to be from the Rape Crisis Center, not knowing that 2 weeks into my STEP program internship, I decided I couldn't do it anymore.
Oh, wow.
Because it hit too close to home. I grew up in the barrio. I grew up with people who were gang members and things like that. And these kids, like, it just, one kid's story, I was sobbing on the way home. Wow. And I was just like, I can't, this is too close. We have to be careful with what's called transference and countertransference. And I just couldn't. And so now that I have my own practice, I'm running a practice. I have 2 under 2. I have my husband and
oh my gosh, 2 under 2. No.
Yeah. And I have supervisees,
God.
and I'm seeing clients.
Girl.
I know. Again, overachiever.
Yeah.
And so realistically, my motivation is remembering I'm breaking generational cycles for my kids. I want my daughter to grow up knowing that her mom helped as many people as I could.
Yeah.
And I want my son to grow up knowing that it is masculine to talk about your feelings. It is masculine to be strong in your emotional vulnerability.
Yeah.
And to be kind. And so I have to remind myself every day as I look at my kids, like, I know it's heavy. This is a season, hopefully, that we're going to be getting through. And I'm doing it for the next generation because not enough people think of the people who are behind us.
Yeah.
And I remind myself of that. So I play with my kids. I play with our pets at home. We go to the park, I let myself vent with all my friends because my friends are all therapists. And so we all just kind of like, man, that was a rough day, huh? And we make jokes about it, and we just kind of we lean on each other. I lean on my community a lot.
Yeah.
Yeah.
Good for you. Maggie, thanks so much for coming on the show. It was a really fun conversation, really enlightening. I learned a lot. And if people want to get connected with you, want to get connected with your practice, how can we help them find a safe space?
So ABC Counseling is on everything, right? If you look up ABC Counseling Inc., it's going to pop up on Google right away. You can go to abccounselingtx.com. That's our website. It has our whole team. We provide free consultations. We believe in client autonomy. So if they wanted to meet with 4 of our clinicians and determine which one they fit the best with, they definitely can.
Oh, nice.
Yeah. So they can email our admin at admin@abccounselingtx.com.
There you go.
Or call 210-957-1668.
Nice. And we'll put that link and the phone number in the show notes. So to help people find you guys. But thanks again for coming on the show, Maggie. Really appreciate it. Great conversation. Wish you and your practice and your clinicians much success.
Thank you.
And excited to see you guys continue doing the work that you're doing.
Yeah, and I'm excited to see who else you interview and continue to see your podcast.
Yeah, this is gonna be fun. We've got so I think you're gonna be the 3rd episode in this series. Mm-hmm. We've got one more interview with another lady from the group, and I really got like I mentioned earlier, a ton of great response.
Yeah.
So I scheduled more folks for later on.
Oh,
so yeah, I'm really excited to bring them on the show and
I'm
highlight.
excited to watch.
Yeah, for sure. Thanks so much for coming on the show. Guys, thanks so much for tuning in to another episode of ChingonSA. This has been a LIS Studios and Serafina Digital production. We'll see you guys next time. This has been an LIS Studio and Serafina Digital production. Be sure to like and subscribe to the show on your favorite platform, and tell a friend about the show by sharing this episode on your Facebook and TikTok. If you're a business owner, entrepreneur, or someone doing really cool things in San Antonio and want to get your story on our show, email us at luis@lealinsurance.com.